Hello, everyone. I'm Dr. Zainab Hijazi, the Global Mental Health Technical Advisor at UNICEF based in New York. I am pleased to be chairing this Child and Youth themed session, part of the Mental Health for All webinar series brought to you by United for Global Mental Health, Lancet Psychiatry, Mental Health Innovation Network, MHPSS.net, and the Global Mental Health Action Network. Before we begin, a reminder to everybody that this session is being recorded. We encourage you to tweet about the webinar throughout the session, so please use the hashtag mental health for all, hashtag MH4all, when tweeting about this webinar. This session will last 45 minutes. Please send any questions to webinars@unitedgmh.org or write them in the chat box. Please allow me to introduce our speakers today. First, we have Andrea Torres with the Bernard Van Leer Foundation. Andrea has over 20 years of experience managing and implementing social public policies and programs, and over 10 years of experience in the early childhood development field. Before joining the foundation, she was the national coordinator of Chile Crece Contigo, Chile Grows With You, the comprehensive protection system for early childhood development at the Ministry of Social Development. Second, we have Bruno Rivalan with the Global Financing Facility. Bruno manages GFF's resource mobilization and engagement with civil society and various global partners. Bruno has over 10 years of experience in designing and implementing policy and advocacy initiatives, managing external relation teams while building relationships with government entities and the media. Previously, he was the Deputy Executive Director at Global Health Advocates based in France, where he led various advocacy campaigns and policy research related to global health and development, and participated in the governance and policy shaping of the global health initiatives, including Gavi, the Global Fund, and UHC 2030. Third, we have Giselle Das with the Child, Adolescent, and Family Services. Giselle is the founding director of CAFS in Sri Lanka. She is a child and adolescent psychologist by profession and is currently carrying out a National Institute of Health Research funded PhD in population health sciences at the University of Bristol in the UK, through which she is looking at how better services could be provided to children and adolescents who are exposed to domestic violence in post-conflict populations in Sri Lanka by linking the school and the healthcare systems. She has over 10 years of experience working in both humanitarian and mental health sectors with vulnerable individuals and families. Last but not least, we have Benjamin Perks. Ben is the head of campaigns and advocacy in the Division of Communications at UNICEF. He is based in New York. He leads on public and policy advocacy and on issues related to the survival, development, and protection of children. He is a member of the Policy Advisory Group on the Global Partnership to End Violence Against Children and serves on a number of other bodies. He previously served in human rights diplomacy roles in North Macedonia and Republic of Montenegro, advocating for reforms to fulfill international human rights commitments and realization of the Sustainable Development Goals. He has also served in Georgia, Kosovo, Afghanistan, India, and Albania. Ben is a public advocate in the fight against violence against children and adverse childhood experiences. Welcome, speakers. Great to have you. So today we're really excited to delve deeply into the topic of child mental health, especially as we've seen increased momentum on mental health, especially during COVID, along with increasing evidence on the dire state of the mental health and psychosocial well-being of our children, adolescents, and families. It really makes now an especially critical time for the global community to elevate the importance of child mental health and take joint action to optimize impacts. Without further ado, I turn to our speakers. Andrea, I'd like to start with you. Children's mental health, well-being, and development is reliant on various factors, both risks and protective, at all levels of the social ecological model, from the child's individual factors to factors in their family, environment, culture, and society. So starting with families, how does the mental health of caregivers impact early childhood development?
Thank you, Zainab. First of all, thank you for having me today, and I'm super proud of sharing the panel with all my fellow panel chips. So thank you for that. And just very quickly reflecting on what you have asked, of course, the mental health of parents and other caregivers is super crucial in shaping their children's future and can have a great impact on early childhood development in different ways, even before the child is even born. For example, there is a strong evidence in low and middle income countries that perinatal mental health conditions are linked to various harmful outcomes in children, such as lower birth weight in babies, of women depressed during pregnancy, higher rates of child respiratory diseases, increase in hospital admissions, and social and emotional difficulties among young children. Parental depression, anxiety, and other issues are connected to various negative child outcomes, as I was mentioned, which will impact them well into their adulthood, such as poor cognitive development and a greater risk of ill health. Those caregivers showing these signs of mental health problems are significantly less likely to engage in positive and interactive parenting practices, and this might be transferred down into generations. So we know that maternal mental health is a problem in all parts of the world, but the evidence is showing us that this problem tends to be most severe in communities which experience poverty, conflict, and other stressors. Mental health are very particularly prevalent in humanitarian situations, for example. On the other hand, I think it is also important to stress that a strong positive parent-child relationship can help build children's resilience, acting as a key buffer in mitigating the impacts of trauma. Positive interactions and responsive relationships between caregivers and their children can support their brain development, and because of that, their physical, mental, and emotional health. We are here at the Bernard van Leer Foundation aim to provide the best start in life for all children. And we believe that the best way to give children a healthy start is to support those people who care for them. So we are talking about parents and caregivers. This means helping them dealing with issues which might negatively impact children and promoting good parenting practices like breastfeeding and responsive play. That has been absolutely demonstrated that with stable, empathetic caregivers, children can flourish, even in the most difficult circumstances.
Thank you so much, Andrea. I mean, such an important area of work, especially with what we know about, children and the statistics that surround the burden of mental disorders and mental health problems. We know that 1 in 4 children is living with a caregiver or parent with a mental disorder, and that is truly a troubling statistic. So really excited to hear about your comprehensive approach to supporting caregivers directly. Bruno, I turn over to you. We are constantly challenged with presenting a coherent narrative to help inform public debates around children and young people's mental health, to help policymakers get a grip on issues that are not currently regarded as policy priorities. As this is an area of your expertise, I'd like to ask, how does the work of the GFF positively impact the mental health of children?
Thanks so much for this question. Let me first thank United for Global Mental Health for inviting the GFF to this webinar. And as Andrea mentioned, really pleased to be with that group of panelists. Maybe before digging into specifically on the GFF contribution, I wanted to present a bit what is the GFF, what is the Global Financing Facility. So we're a country-led partnership hosted at the World Bank that unites domestic and global partners around a national plan that prioritize and fund the most cost-effective proven intervention to improve the health of women, children, and adolescents but also building resilient and equitable health systems. So we use small amount of grant financing with larger amount of World Bank, IDA, and RBRD to catalyze that country-led process. So our financing is flexible, and we really support government and institutions to empower themselves. So we are helping on the preparatory work, on the data and evidence. We're providing technical assistance to really fund the individual priorities which help each country reach their specific goals. This means eliminating the bottlenecks in health system, collecting the data, and finding, as I've mentioned, the cost-efficient but sustainable intervention. And so we're working with ministries of finance and health in each of those countries to also allocate existing and additional resources, really trying to make sure that there is sustainable financing and often to the front line of healthcare. And so beyond those specific services, we have that policy and legislative agenda, as well as the increased financing. And when we say that the GFF is a country-led mechanism, it means that we're not here to dictate what countries should do. And so every plan in the country that we are support, which is called investment case, is really specific to each of the country's journey. And so while we support some of the early childhood development, early learning, early STEAM, parenting, and of course health and nutrition in most of the countries, we don't have a specific mental health lens necessarily in all countries, but we can impact positively mental health through ensuring that prevention and treatment is part of that integrated maternal and child health intervention. And so, for instance, in the northeast states of Nigeria, we have worked with local government to reestablish services such as psychosocial support, mental health, but again, as part of a maternal newborn and child health and nutrition support. We're also supporting mental health elements of the health system in DRC. And in other countries, we can support intervention aimed at improving, and I think that relates to what you're saying, Andrea, improving parenting and the mother-infant relationship, which have been, effective in preventing some of those issues. So that's let's say the contribution that the GFF can make on this agenda. And of course, there's much more that we could do moving forward. But happy to hear from others before, and I can dig into that later.
Thanks, Bruno. And if you allow me, just a really quick follow-up. I mean, you mentioned the development of investment cases. I just wonder if you have worked on mental health investment cases, and also you reference, working on mental health elements of health systems. I wonder, since mental health is really a multi-sectoral area of work, whether or not you're also kind of looking at mental health elements as part of, other care systems, including education and social welfare and so on. So would love a quick clarification from your end on that.
Great. On the investment case, I mean, just to clarify again, we're trying to take an approach that is a broader women, children, and adolescent health investment case that really look at the comprehensive package of interventions that are needed and the health-related reforms to make those interventions accessible to the ones that are especially further behind. So we don't have specific themes as part of the investment case, but really trying to get that comprehensive approach. And within that, in some countries, because it's a country-led process, in some countries you will have a particular emphasis on specific elements, and I've mentioned two countries, Nigeria and DRC, where there is a particular focus on mental health, but again integrated into the broader health system discussion.
Thank you so much.
As for the multi-sectoral, nature, we indeed have investment linked to education and social protection, but again in a more comprehensive way, not specific to mental health at this stage.
Thank you so much, Bruno, for clarifying. I'm definitely really excited to learn more about GFF and the broader contribution to mental health of children, but also at the national level, as you rightfully explained. Giselle, over to you. There is really often a confusion of what we mean by community-based approaches to mental health. Since we are not saying, community-targeted services, we often really refer to the various types of services, including specialized services, as community-based, provided they are part of a more strategic psychosocial and mental health approach with the aim to build on existing individual and community resources, capacities, and resilience. On that note, I was wondering if you could share with us how the Child, Adolescent, and Family Services take a more community-based approach to children's mental health in your work.
Sure. Just again, like the other panelists, I want to say thank you for inviting us to be a part of this discussion. So the Child, Adolescent, and Family Services, we take on more sort of a homely space approach as opposed to the standard clinical setting. You would see children and their families would go into to seek support. Stigma around mental health is quite high, and especially in countries such as Sri Lanka. And we've noticed that children and their families feel much more comfortable to come into our facility to seek support in various ways. We also try as much as we can to, be sort of part of the family. We incorporate, with the school settings, with the child sort of family network, with their social sort of network, to be connected in a holistic manner to provide care right throughout. Also, apart from this, another approach that we take is, apart from the clinical service, we also run a number of campaigns and workshops in order to create awareness and reduce the stigma in the community. We also have an internship program that we run for budding psychologists and other professionals in the mental health field so that they can, in a sense, learn what we call the CAF's way of providing care and support.
Thank you so much, Giselle. I know, Ben will speak to this, and stigma is such a critical issue in all of our approaches, and we really need to be tackling stigma at all levels, and really kind of changing the narrative around mental health so that it is more accessible, and the people who need it the most are receiving that care. So thank you for the work that you do. Ben, we know that a critical part of addressing the global burden of mental disorders is advancing laws, policies, advocacy, and human rights for improved mental health and psychosocial well-being and development in children. And there is really this need to improve and better coordinate our advocacy efforts at all levels. On that note, we know that UNICEF is launching its new 4-year global advocacy strategy on mental health. Can you tell us a little bit about this advocacy strategy and the key areas that it will focus on?
Yeah, for sure, Zainab, and thank you so much for the opportunity to participate with such a great panel today. The global advocacy priority on mental health means that we are elevating the topic within UNICEF's global advocacy work, that we will do our best to bring together our presence across 190 countries with our partners and others to really call government to action in what I would call really 3 critical areas. I call them the 3 C's. So the first one is about commitment. It's about an investment, not just in the health sector, but in the education sector, in the child protection sector, and other sectors that address really the full need of promotion, prevention, and treatment in regard to mental health. So the 3 C's are that this commitment, this investment, recognizing the cost of inaction and putting very robust case for that investment for governments. The second C is about connection and recognizing that a major risk factor for children, particularly something we've learned so much about from all of the science over the past few years, is when connection is disrupted, connection in the family and in the community and in the school. But now we have in our hands knowledge of the solutions that we can promote good parental-child connection and attachment through parenting programs that can be low cost and evidence-based. that this is probably the single greatest protective factor we have for overall life cycle well-being, mental and emotional well-being of children. Also, connection in the community and the school. The schools are encouraged to provide basic services that promote and respond to mental health, but also the schools go beyond that and make sure that every child has a sense of connection and belonging within their community. This is now known to be a major protective factor for children's mental health, and there's a lot of evidence now on the fact that schools can become trauma informed, can make sure that no child is left isolated or disconnected. I think the third C is really about changing the conversation, having a global conversation. I think if we have the challenge with mental health that often we don't have data from most countries, and most countries have not had a conversation, a public conversation about mental health. And when there is a conversation about mental health, it's often steeped in shame and stigma and judgment, and we really need to break down that those barriers and really open up public conversation. So to make sure that conversation is accessible, is stigma-free, and helps people to identify and understand the problem. So 3 C's, commitment from governments to invest, addressing the connection of children in families through parenting programs and supportive school environments. And the third C is about opening up a global public conversation that really needs to be had on mental health and the related issues.
Thanks so much, Ben. I mean, you touched on something that's really important, and indeed around the life cycle approach as well. And we really know the importance of acting early in creating mentally healthy environments for children from the early years through childhood and adolescence. And indeed, parenting programs, schools, communities are the best avenue for support and to really ensure that, broad prevention, promotive treatment continuum as part of more comprehensive system of care. So thank you so much for that. And really on the kind of acting early piece, I think that's a really good bridge to bring it back to Andrea. Andrea, you spoke thoughtfully earlier about caregivers' mental health. And I would like to expand on that a little bit by linking to what Ben was saying. The Bernard Van Leer Foundation has programs in a range of countries. How are you integrating mental health into your early childhood development programs and your support for caregivers?
Sorry, I was muted. So long using this kind of platform, I'm still forgetting unmuting myself. So thank you, Zainab, for that question. As I mentioned before, we here at the Bernard Van Leer Foundation believe that every child deserves a fair start in life. And for us, parents and caregivers are essential to that goal, as we have been discussing and hearing from each one of you as well. And we have been trying different pathways of integrating mental health into our work. We have just built last year an internal strategy to better integrate mental health. And actually, we are addressing 3 specific goals in that sense. We want to increase awareness and funding for caregivers and mental health psychosocial support globally. And that means how can we engage leaders that can take meaningful actions? For example, as Ben was mentioning, leaders advocating for more funding to mental health. We also aim to expand our experience and understanding of what mental health psychosocial support means in terms of the best experiences, the best practices to support caregivers and young children, globally, nationally, and of course in humanitarian settings. We already know that less than 1% of development assistance for health is spent on mental health. And finally, in terms of our internal goals, we want to better integrate mental health support into our two main programs, which are Parents Plus, which actually links parent coaching with other supports that family might need, and Urban 95 programs. Just to be very concrete, we have established a partnership with United for Global Mental Health to actually strengthen advocacy for caregivers' mental health on a global level. We have also partnered with WHO maternal mental health departments so that they can develop a field test and implementation guide to support integration of maternal mental health interventions into existing maternal and child health services. And as you mentioned, we are currently working in India, Brazil, Israel, Jordan, and the Netherlands and Peru as our core geography. And in each one of those countries, we aim to have at least one mental health and psychosocial support investment. For example, in Peru, they are already working on how to improve the monitoring of mothers' mental health. In Brazil, we are supporting the implementation of Criança Feliz, one of the biggest home visiting programs in the world, and they are promoting positive caregivers and children's interaction in vulnerable families. And finally, we have this program called Urban 95, which actually invites city leaders and urban planners to look at the city from the perspective of a 95 centimeters, which is the average of height of a 3-year-old child.
Right.
And we invite them to answer, what would you change if you could experience the city from that perspective? Following that challenge, we are also working to integrate mental health metrics into existing Urban 95 initiatives by defining urban space factors that can impact caregivers' mental health, such as access to green spaces and nature, safety, mobility and connections, air pollution, access to public spaces, etc. So we do have a big of a challenge trying to integrate all of mental health in all of our work. And I was just thinking about what Ben was sharing with us, and I really love it because we are already committed to expand this work. We are actually doing the connections, not only about good parenting coaching support, but also like connecting globally. And we are trying to change the conversation for starting, for example, not having good data. We just finished a project with United for Global Mental Health about collecting key indicators on affecting young children's mental health. So I think that we are super aligned on this challenge. Thank you.
Thank you so much, Andrea. I'm really heartened by how much is happening in this space. I think it's truly, truly wonderful. And just kind of listening to everyone, there's so many linkages between all of our different organizational efforts. Just a quick follow-up on what you said, Andrea. You were talking about Urban 95. Sounds like a wonderful initiative. I wonder if there are any connections or perhaps a request from your end to make a connection to the World Economics Forum work on child-friendly cities, where there have been recent, a recent push to ensure that there are clearer linkages to the mental health global agenda as well in that space. Just wondering if you are aware, or of course if there would be interest on your end in making that connection.
Absolutely, we will be super interested on making those connections, because actually, especially now in the COVID-19 pandemic and after the post-COVID-19 recovery, we need to think about cities and how those cities are supporting caregivers' mental health. And it's clear that most of big cities are not supporting caregivers. So actually, we invite leaders across the world, like, look at your city and please experience it from the perspective of a 3-year-old. What could you change? How can we ask caregivers to actually go to their homes and be positive and building nice connection if they have to travel 2 hours to get there, or if they are losing their jobs or stuff like that. So most of the time we think about mental health linked to education, social protection, and health, but actually in your ecological framework that you were citing before, how cities are built is super important in terms of what is happening with those families and the opportunity for them to actually support young children. So yes, we are trying to touch on all of urban leaders and city planners that are usually not the people related to early childhood development. We want to challenge them. How can we think the city in the future that is actually functions well for young children, and if it functions well for young children, it will function well for the whole society. So great point. Thank you, Zainab.
Thank you so much, Andrea. Really, really interesting to hear your thoughts on this. Bruno, I turn to you, and really just building on what has been said so far, it's really no surprise that mental health is a global issue, and yet it remains stigmatized, as we've heard, and underfunded in almost every country, rich or poor. So my question to you is, what opportunities do you see within the GFF for increasing funding and access to mental health services?
Thanks. And I think it's really important that we put that into the perspective of the COVID-19 pandemic and recovery, as Andrea mentioned. And really, you know, in addition to that kind of short-term shocks, we're seeing really how the pandemic is threatening to turn back progress in the health of women, children, and adolescent health. We have seen, you know, disruption in key services for those population, around 25% drop in coverage of key interventions such as family planning, such as vaccination, such as pregnant women not being able to receive care during childbirth. And we know that women and girls are also borne the brunt of that secondary health crisis, as we're calling it, with gender-based violence, protracted school closure, job loss, as you mentioned, also Andrea. And also increase in unpaid care. So what is clear is that the impact on mental health and psychosocial well-being of the most affected is significant. And we have just launched the GFF new strategy for the next 5 years, with the aim of raising 1.2 billion in 2021 as part of a broader resource to protect and access to a comprehensive essential health services, really reclaiming the health gains, but also making sure that we can expand, you know, the pool of services that are essential for women, children, and adolescent health. And if we are resourced this year, there are some opportunity to push this agenda forward for scaling up the inclusion of mental health intervention in primary healthcare setting, and particularly where we see our role to facilitate that discussion is in fragile states, conflict or post-conflict countries. And so maybe two concrete way forward, and that builds on Ben's two C's, I would say. First, on maybe the commitment and the conversation. So really at the country level, on the policy dialogue and the advocacy. So we are trying to expand the number of partners that contributes to the country-led process that I've mentioned, so to that investment case that you were asking more details about, and making sure that there is more diverse participation, inclusion of different advocacy groups, of affected communities, including possibly linkages with networks that are focusing on mental health, and really with the idea of making sure that mental health is maybe further featured in the government's priorities. And so we are launching a new CSO and youth engagement framework that will support accountability efforts and advocacy with country level grants for grassroots organization. And that, I think, can help some of the campaigning for positioning mental health as a prerequisite for an effective health system. So that's the first and clear maybe step moving forward. The second is our focus on trying to reimagine how you deliver services and what type of services, and the support around the data and evidence for decision making. And so we are working with World Bank colleagues on the trying to look at the critical role of maternal depression in infant and child health, both as a risk factor, but also as a mechanism for poor health, which has implications for prevention as well as intervention. So really trying to build more data, more evidence on including mental health in investment case if countries feel able to do so. So it's looking at the different entry points in collaboration with the World Bank country teams for the integration of evidence-based intervention within a GFF finance project, but also develop a practice note with the country level teams and the government counterparts. We're trying to show how you can operationalize those evidence-based guidance as appropriate. So really trying to push that agenda further on the data and evidence, but also an opportunity on the advocacy and that public conversation that is needed to bring that priority forward.
Thank you so much, Bruno. It's really great to also hear about these, global resource mobilization efforts that are actually very, grassroots, founded through grassroots, a grassroots approach, and one that is also data and evidence driven, which is really critical for scaling up, but also scaling deep and ensuring quality. So thank you so much for that. Giselle, coming to you now, we've established quite well the gravity of mental health needs among children, and we know when they are exposed to poverty, violence, disease, or humanitarian crisis, these needs are exacerbated. But what would you say is the most pressing issue with child mental health at the moment, and how has this changed with the COVID-19 pandemic?
I think like what we've been talking so much about these few minutes is that talking about how children exist in the context of their carers, and looking at it from that aspect, parents are under a lot of stress, especially with this pandemic. There are job losses, there is lack of social support, and also this whole homeschooling of children, which takes a significant toll not only on the children but also on the parents. And we see this even more significant when the parents themselves are educators, and there's a lot of pressure and stress on children also, not knowing the uncertainty about their future, about their education, where they're heading, opportunities. And there's a lot of frustration that we're seeing not only within children, but also the parents, their carers, and educators in the school system. Also, the added frustration is not being able to access their social networks. And this again goes with the parents, and it again goes with the children as well. And children end up spending an increased amount of time on screens for obvious reasons, because schooling is now everything's online. There are also a lot of conflicts that take place with behavioral problems, sleep issues for children, and all of these have created a lot of tension within the families, between parents, between children, arguments that are happening between what is the appropriate way of providing parental care and support. And there are lots of these issues that we see coming up. There's definitely an increased need to strengthen this family dynamics and also the overall well-being of parents as well as their children in order to address the mental health issues that we're currently seeing at a significant sort of rise with children and also with parents that in turn affect the mental well-being of children.
Thank you so much, Giselle. No, I think that's such a thoughtful response, and a reminder that we've all been affected by COVID in one shape or form. We often talk about the collective experience, but lest we forget the individual experiences as well, so that they are not drowned by these generalized notions of what we are experiencing or not. So thank you so much for that. Ben, I'd like to pose my final question to you before opening for questions. You told us about UNICEF's global mental health advocacy strategy and highlighted some key moments. And I believe one of those key moments is the State of the World's Children report that is focused on mental health and well-being this year. Can you tell us what the State of the World's Children's report is and how it will catalyze policy change to enable better access and investment in children's mental health?
State of the World's Children is UNICEF's flagship publication. We bring it out every couple of years, and it focuses on a really important thematic issue. So the last one was about nutrition, and it was leveraged in country level, but also across multilateral platforms to advocate for investment in and response to the issues that are addressed. For example, the last one was about nutrition. So we will in October hopefully launch the this year's State of the World's Children on mental health. And I think it will try to bring together 4 key things. The first one is to look at the scope and the prevalence, and to try to bring together the limited evidence we have to kind of draw a picture of where we are in terms of child and adolescent mental health globally. And what are we talking about when we talk about child and adolescent mental health? The second will be to look at what the science is telling us about the protective factors that prevent children from having poor mental health outcomes. And thirdly, what are the risk factors, what are the things that make them more likely to have poor mental health outcomes? And fourthly, building on what we know about risk and protective factors, proposing policy solutions and investments. We are a unique time in history. We know more than we have ever known before about children's mental health and the risks and the solutions to the issue. So the State of the World's Children will try to bring together a lot of that evidence and use it to really accelerate our advocacy for the 3 C's.
Thank you, Ben. I hope you're coining the 3 C's. It seems like everyone's on board. So opening it up now for questions. We have a question for Andrea from the floor, from the audience. Is there a way that parent plus or parenting and other types of programs on maternal mental health can be accessed by the practitioners working in the Middle East, especially in Bahrain, where there is a huge stigma and the maternal responsibility to take care of the of children with special needs or children with disabilities is huge, with minimum family and social supports available to them?
Thank you for the question, and I fully agree that there is a lot of pending investments and programmatic support in different areas. And the question just mentioned about the stigma, and I think that is something super relevant to address, and how can we promote behavioral change, and to promote behavioral change on the ground regarding mental health. I would say that we need to understand which are the specific cultural factors on the ground. Like probably there is different than what is happening in Latin America or what is happening in Europe. So I would say that parenting coaching can be a very cost-effective intervention in terms of promoting mental health practices, supporting caregivers, and that needs to be adapted to the specific characteristic of each country. Of course, there are some global funding that can support. I don't know the specific situation in that country, but I imagine that there are global actors that could support in terms of how can we embed parenting coaching support, which is actually, I would say, I would insist, very cost-effective intervention. Sometimes you don't require to spend a lot of money. You just need to organize your service provision in a different way, and actually highlighting what are the specific things that you want to address in terms of supporting caregivers' mental health. I don't know if I'm answering the question, but at least I'm hoping giving some ideas about it.
Thank you so much, Andrea. I do apologize to everyone. We don't have time for additional questions. And thank you all. Really, this has indeed been a stimulating discussion. We are nearing the end of the webinar and would like to hand over to the panelists one more time and invite you to share a tweet-length answer to the following question. This week, finance ministers around the world are attending the World Bank and the International Monetary Fund spring meetings. If you could increase funding in one area, what would you prioritize? Let's start again with you, Andrea, then Giselle, Bruno, and finally Ben.
Thank you very much. Invest in early screening and treatment for maternal depression, very cost-effective intervention that will have a high return of investment, not only for those women, but for the whole family, and in particularly for babies, toddlers, and the whole society. If you don't put money on it, it's not a priority.
Thank you, Andrea. Giselle?
Well, I would say more funding for programs to support mental health carers and also educators. Because in order to support children better, we need to make sure we are supporting those who are directly involved in their lives.
Thank you, Giselle. Bruno?
Investing in the comprehensive health of women, children, and adolescents. We must accelerate efforts and move faster. If we don't increase investment now, life will be lost, progress will be undone. This will hinder countries' abilities to build the human capital needed and to recover from the health and economic crisis. And so basically, we must reclaim the gains.
Thank you so much, Bruno. Ben?
Parenting programs. I would invest in parenting programs the way that we invested in vaccines to make them universally available for every child everywhere. I think that's the best possible accelerator that we have and the most cost effective.
Thank you so much, panelists. Thank you for joining us. Thank you everyone for joining us for this important discussion. We are at time, so please allow me to close. A reminder that the recording and notes of the session will be posted on United for Global Mental Health's website very shortly. I will be chairing the next session at the same time on April 20th, focusing on youth mental health. You can visit the United for Global Mental Health website to join, or email webinars@unitedgmh.org to submit questions in advance of the session. Thank you, dear speakers, for your wonderful inputs and for sharing your expertise and knowledge with us today. I invite you, both the audience and the panelists, to continue the discussion on social media. See you next time. Stay safe and take care.
Thank you.
Bye-bye.
Bye-bye.
Thank you so much, Sam. Bye-bye.